Welcome to Autism Awareness and Inclusive Practices by Odyra Integration Collective. Our purpose is to spark your journey and ignite your potential through understanding and inclusion. The Odyra Integration Collective focuses on 3 strategic areas: integration, guidance, and innovation. We believe in building a shared world that respects everyone's needs and adapting environments, not people, for true inclusion. By the end of this video, you will be able to define autism spectrum disorder, outline its challenges, explain different syndromes, identify causes, symptoms, and treatments, discuss communication strategies, and recognize behavioral patterns. Key characteristics of ASD include differences in social communication, restricted interests and repetitive behaviors, and unique sensory processing. Remember, autism is a spectrum, meaning each individual's experience is unique. Here are some statistics on autism. This information highlights the prevalence and aspects of diagnoses and support within the autistic community. Rethinking the quote-quote spectrum means shifting from a deficit-based model to one that emphasizes strengths, autonomy, and support systems. The goal is to work with autistic individuals, not to normalize them. Key aspects of rethinking the spectrum include embracing neurodiversity, focusing on strengths, reconceptualizing support as a partnership, recognizing heterogeneity, acknowledging complex causes, and adapting assessment processes to be strengths-based. Understanding autism involves re-examining repetitive behaviors as self-regulatory, recognizing inflexibility in behavior, and acknowledging varying support needs for navigating social situations and daily organization. A modern understanding, DSM-5, categorizes autism as one diagnosis, a spectrum. Old terms like Asperger's syndrome are no longer formal diagnoses, recognizing the wide range of characteristics within the spectrum. Autism has complex causes, with research strongly suggesting it develops from a combination of genetic and environmental factors. Genetic factors are the largest contributor, and prenatal factors can also play a role. Today, autism diagnosis focuses on quote support levels. These levels indicate the amount of assistance an individual needs to thrive in their daily life and social interactions. ASD level 1 requires support. Individuals may have noticeable difficulties initiating social interactions, struggle with conversation, experience inflexibility in behavior, and need some help with daily organization. ASD level 2 requires substantial support. Individuals exhibit marked deficits in communication, limited social interactions, and obvious inflexibility that interferes with functioning. Ongoing support is essential for social and daily life. ASD level 3 requires very substantial support. Individuals show severe deficits in communication, very limited social interaction, and extreme difficulty coping with change, requiring often 24/7 support for all aspects of life. Learning the early signs of autism and developmental milestones is crucial for parents and caregivers. Early recognition can significantly impact outcomes. At 6 months, babies may show few big smiles or limited eye contact. By 9 months, there might be little or no back and forth sharing of sounds or facial expressions. By 12 months, toddlers may show little or no babbling, gestures, or response to their name. At 16 months, very few words, and by 24 months, few meaningful 2-word phrases. Signs of autism in all ages can include loss of skills, avoidance of eye contact, persistent solitude, difficulty understanding feelings, delayed language, echolalia, resistance to change, restricted interests, repetitive behaviors, and intense sensory reactions. The age of autism diagnoses varies. Some children show early signs within 12 months, others later. Some may develop skills and then lose them around 18 to 24 months. If you have concerns about your child's development, learn the signs, take the MCHAT-R online screening, and schedule an appointment with your doctor. Early intervention can dramatically improve outcomes. Beyond labels, neurodiversity recognizes that human brains have natural variations. Autism, ADHD, and dyslexia are seen as these variations, not defects. The goal is an inclusive world that celebrates these differences. Various therapies and support systems exist for individuals with autism. These include behavioral therapies, speech-language therapy, occupational therapy, social skills training, and medication to manage co-occurring conditions. Behavioral therapies like ABA use scientifically based approaches such as positive reinforcement, antecedent manipulation, skill acquisition, and individualized treatment to improve behaviors and skills. Speech-language therapy addresses communication and swallowing disorders, aiming to improve speech clarity, language comprehension, and overall communication skills through various techniques and activities. Occupational therapy enhances independence and self-care, improves cognitive and physical skills, and promotes well-being. Services include evaluations, individualized plans, and therapeutic techniques like adaptive equipment training. Social skills training teaches communication, emotional regulation, conflict resolution, problem-solving, and peer relation skills. It uses direct instruction, role-playing, and visual supports to help individuals apply skills in daily life. Medication supports symptom management, such as aggression in ASD, but doesn't offer a cure. Prescribed by professionals, it works alongside other therapies. Benefits include reduced aggression and improved focus, but side effects are possible. Autism manifests differently across age groups. Let's explore some key distinctions between children and adults regarding socializing, communicating, thinking, and processing. Autistic children may prefer solitary play or highly structured interactions, use less speech, need extra processing time, and use stimming. Autistic adults prefer literal language, enjoy info dumping, may use unexpected body language, and form online friendships. Autistic children often have deep or single abiding interests and unique sensory processing differences. Autistic adults may be orthogonal thinkers, focus on details, process information literally, and have specific, special interests they can hyperfocus on. These differences are simply autistic ways of being in the world. Autistic children and adults possess their own organic processing and social skills. Adults may mask their autistic traits, which can take a mental health toll. Every autistic person is unique. Autism is a neurodevelopmental condition, and intellectual disability does not always co-occur. Autistic individuals have emotions and desire relationships. Diagnosis is not limited by gender or race, and violence is not inherently more prevalent. Together, we are embracing, supporting, and including. We are not just moving forward, we are navigating a new path towards a more inclusive world. Thank you for your attention. For further learning and more information, please visit odiracreative.com.